Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. The speakers and planning committee members have disclosed no conflict of interest. To receive contact hours for this educational activity, participants are required to attend the webinar and complete the evaluation form, which will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentations, we may have time for questions and answers. If you would like to ask a question during the presentation, you may do so in the GoToWebinar control panel. You should see on your GoToWebinar control panel on the screen, you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenters. Be sure to hit send so that the message makes it to us. On behalf of Sigma, we would like to thank our speakers for sharing their expertise with us today. Our speakers will consist of the following. Nurse Clarissa is a teaching fellow in nursing studies at the University of Edinburgh. She started her nursing career as an intensive care nurse in Indonesia, which has inspired her passion for improving the recovery of critically ill patients. She passed her PhD Viva in 2020, and her research is about staff experiences related to early mobilization with mechanically ventilated patients. Nurse Jed Webb is a critical care registered nurse and is currently completing her PhD at Deakin University School of Nursing and Midwifery. She also works with Monash Health's Nursing and Midwifery Informatics team. She has worked as a critical care registered nurse specializing in cardiothoracics, has taught and worked in nursing research, and co-supervises nursing honors students. Dr. Lauren Ramaki joined Chaminade University as a faculty member in fall of 2017. Her background and field of passion lies in psychiatric mental health nursing and public health nursing, specifically in relation to PTSD, disaster preparedness, mitigation, and response. Thank you, all of you, for joining us today. And I'm going to head and turn the presentation over to Clarissa.
Thank you, Megan, for the introduction. We are very delighted to share with all of you these 20 tips and tricks for early career nurses at this session. There are 2 expected outcomes of this webinar. First, to discuss one resource for supporting a transition into the nursing profession. And second, to describe at least 2 ideas that can be implemented by your next working shift to facilitate a transition into a nursing specialty. So I will hand over to my colleague Beck that will kick off with the first tip.
Thanks, Clarissa. So tip number 1 is that your first year as a nurse is the toughest. And we've all been there and we all know that it can be really tough. All nurses who are new in the profession undergo that same period of adjustment. So just be patient with yourself, and trying to consolidate everything can be really hard. So don't be too hard on yourselves. I wanted to ask you, Lauren, what's one thing you remember about your first year?
Sure, thank you. So I think for my first year, I will never forget that kind of overwhelming feeling of just having so much information coming at you at once. I remember thinking I had learned everything that there was to know in nursing school, and then being absolutely blown away by the amount of information that was coming at me afterwards that they don't teach you in nursing school, that you have to learn kind of on the job and as you go. And and for some people, it's even a little bit more than a year, depending on the field that you're in and all the information. And we're really learning forever. But I think in that first year, it was definitely the toughest. And every day, I just had to go home, kind of look up all the things that happened with my patients, figure out. It was like studying for a whole year after school. So it was definitely an adjustment. But by the end of that, all of a sudden a few years go by and you can't believe how much information you actually know and remember. And now you're probably teaching somebody else. So it does get better.
Awesome, thanks. I'll pass on to Clarissa for tip number 2.
Yeah, so let's continue with tip number 2. Look at the patient or client holistically. Work with the whole patient or client. So this might include their family, extended family, friends, or other loved ones. This may seem easy to do, but it's also easy to forget if the individual or their family are tiring. So here's an example of mine. When I was an ICU nurse in Indonesia, I often was to focus on my patient's physical stability and sometimes omitted non routine care such as washing my patient's hair, and especially since my patients mostly were unconscious and didn't really ask for it. But one day, the unit wasn't too busy, and so we washed a patient's hair. And when the patient's son came into the unit, and so her mother's hair clean and fresh, he thanked us and really appreciated that, which also made me feeling satisfied. And now I'm going to ask my panelists back. Has this been also an issue for you?
I think, yeah, it has been. In Australia, we're very multicultural, have lots of people from many different backgrounds, lots of different languages and different cultural practices. So use the patient's family or friends or visitors to your advantage, as well as sometimes for that understanding, but also they know them really well. So if they're telling you something's different or something's wrong, I found that really helpful because you might only know them for, your shift or that little bit beforehand. So take that to your advantage and use that. Yeah.
Okay, that's excellent. Let's move on to the next tip. Over to you, Lauren.
So the next tip is ask all the questions you have in your mind and really take advantage of your preceptorship if you have one and utilize that time to really kind of hone in on all the things that you don't know. And, from my own personal experience, I mean, people always say, like, there is no such thing as a stupid question. I have definitely asked stupid questions, and that's okay. And kind of self-reflecting on it afterwards, like, well, maybe I could have looked that up, things like that. But really taking advantage of your preceptor, they're there to help you. And even though your learning styles might not match up or their teaching styles and your learning styles, ask it anyways. It can't hurt, and sometimes it can even prevent errors later on. So I wanted to ask you, Clarissa, who was your favorite preceptor and what made them really great in your mind?
So I had this senior colleague that was my preceptor. She always tried to find me when she was about to do nursing tasks that she knew that I hadn't done before, so I could observe. But I wanted to add earlier to the tip about asking questions. I think this not only applies to asking questions to your preceptors, but this can also apply to your other colleagues, be it nurses, physicians, physios, dietitians. And usually I love to ask them about the treatment that they're giving to my patients. So usually I just say, I want to learn from you. Could you explain it for me? Could you explain it to me? And then usually they're very happy to explain.
Thank you. And I really like what you mentioned about your preceptor because I think for me, when I had my favorite preceptor, it was just really about like emulating her too and really he created an environment for me, which made me realize how I wanted to be as a preceptor to other students, of just that open and kind of availability to ask anything that I wanted. So I'll turn it over to Beck for the next.
Thanks. So tip number 4 is delegate tasks because we can't do all the work on our own. There's a reason why we have a multidisciplinary, big healthcare team. And if you can delegate tasks to nursing aides or techs or assistants, depending what you have available in your healthcare setting or in your country, do so in a respectful manner and ask their opinions as well on patient care, which goes back to the tip what you're both just saying about asking other people's opinions or advice and help. This way everyone feels like they're part of the team and everyone gets to contribute to the patient's care. I wanted to ask you, Lauren, because we don't have them necessarily in Australia like they do, I think, over there, but have you been a nursing aide or a tech before?
I have. So when I was in nursing school, I was a nurse's aide all throughout. And it was really helpful to me when I became a nurse because I really understood the role that they played and what it was like for them. I think it's really important to understand like what other people's jobs are, especially if you're going to be delegating tasks to them. And it's really important as a nurse to be able to delegate those tasks because you can't do it all by yourself, even though, I've definitely been guilty of trying to do all the things, right? But we work as a team in nursing, so it's really important. And as a nurse's aide, I think the things that were really important for me when I worked in a team with nurses is I really loved when they did ask me my opinions. One, it made me feel empowered, right? That somebody actually cared what I thought, because I spent a lot of time with the patient. Just as nurses spend a lot of time with the patient, the doctor or provider asking us, we have the insight into what's going on with them. So I think one, including them in the process, really making them a part of the team and not just kind of appendage to it, is really important, and you'll kind of see them start to shine. And also, just to add, while it's important to delegate tasks, I always try to remember as a nurse what it was like to be a nurse's aide and try to offer help when I can. That maybe is something I could delegate, but if I see they're in a really busy day, to really jump in and try to help them, because that kind of helps them more. But never forget.
Yeah. And I do have to correct myself. I just realized we do have an equivalent of like an undergraduate student working while they're studying. So I apologize to my fellow Australians. And I'll pass over to you, Clarissa, for the next tip.
Yes, so tip number 5, although difficult, don't dwell on the past. So if you make mistakes, don't dwell on them. What's important is you learn from your mistakes and move on. And yes, I also made some mistakes in the past. And one of them that was still very fresh in my mind when I knocked down an IV pole that hit my patient head. So it was very, very horrible. I was very panicked at the time, so rushed to find my charge nurse, admitted all my mistake, and she was very calm and kind, didn't blame me at all. She came with me to the patient's room, assessed the patient, and I was lucky that the patient didn't sustain any injury. But after that experience, I was always super, super careful when entering the patient's room, ensuring the scene safety and every single my nursing care. So after that horrible experience, I learned from my mistakes. um, Now I'm going to ask Lauren if she has any similar experience or maybe witnessed any mistakes.
Absolutely. I mean, I would be astonished to find a nurse that hasn't made a mistake in their career, right? And I think the important thing about it is really learning from your mistakes, just like Clarissa mentioned in her scenario. I remember when I was a new grad, one, I was very fearful of making a mistake. Even though I had a really supportive staff and supervisor, you're just so fearful you're going to do something wrong or hurt your patient. But sometimes being fearful can actually make you make mistakes, right? So kind of realizing that about yourself. And really focusing on, I remember I had, I think it was, I don't remember what med it was, but I remember we were transcribing meds. We didn't have an electronic health record at this time. And I was transcribing meds, and I forgot to transcribe one of the parameters that went with it. So when a nurse went to give the med, we didn't have the parameters with it and gave it when they weren't supposed to. And I remember just being horrified, and nothing bad came of it, but I remember being like, I immediately felt so terrible about it. And I had a lovely supervisor, and really turned it into an educational experience for me. And I never did that again. I double, triple checked everything that I did from that forward. And another thing to remember too is that, own it, right? It's about integrity. So people can often feel like they want to hide a mistake, but remember, a lot of times it's a system thing. So there's something in place that could happen, and it could happen to other people. So if we don't kind of own it and look at those mistakes, it could happen to somebody else, and eventually maybe hurt a patient. So that would be my biggest advice would be to make sure just it's not just you; it could happen to anybody. So.
Yes, I think that's very important. Thank you for sharing your story, Lauren. Yeah, we learn from our mistakes. Let's move on to tip number 6. So over to you, Beck.
Thank you. So tip number 6 is be specific and direct to the point. I find this especially relevant when asking questions of your patient. Always be specific and direct. They don't often know our nursing language or our lingo or our jargon or the medical jargon. I find, trying to reflect on back before nursing, what did you understand? And unless, maybe you watch a lot of TV shows, it's still not the same thing as really being there and having healthcare providers in front of you speaking, and then you can just see the patient not following, or their family or their carers. I just wanted to ask you, Clarissa, have you ever had a conversation with a patient or their family and realised they had no clue what you were talking about? Because it's definitely happened to me.
Yes, so my tip is to observe body language and nonverbal cues, basically. So usually I know that my patient or their family didn't understand at all if they tended to be very, very quiet and just stared at me without saying anything. So usually I would ask them, can you repeat what I have explained? Just to check if I gave you the clear information. And usually they would say, that, okay, like this. And then I can kind of rectify from that and explain the parts that they didn't understand. So yeah, that's how I
That's a
did.
great tip. Good job. Over to you, Lauren. Next tip.
So, tip number 7, develop habits now. And this is really important. One, I would say every time I look at the medication, especially in my first year, again, I remember coming out of school thinking I had a lot of information and then just being completely blown away. I had a little binder that I kept kind of with me when I would give it out for the most common meds, and I, made sure I looked them up. And if I didn't know something, I made sure I looked them up right away. Another thing that I did is making sure that I did everything as early as possible in the day instead of not necessarily procrastinating, but feeling like I could spread them out in the day because something always comes up and you can never kind of prepare for it. So those are kind of two of my things that I did to kind of keep myself organized and my daily checklist of things that I needed to get done that were important. So I wanted to ask you guys, what kind of good or productive habits have you developed over time that have helped you?
Thanks. Yeah. So mine's definitely the shift planner, which is what we called our planner. So it had, like a table and literally every hour, if there was things that you had to do. Some nurses, I used to be in awe of them and think, oh, how are they remembering to do everything? But now I just realize their memory and their way of doing it was different. I didn't do well with that. I'd get really overwhelmed. So even if it was things like, okay, it's a daily wound dressing, like you said, do it early in the day if you can. But even if I didn't get there or something's popped up, which always does, at least it was good to hand that over to the next nurse or to whoever was looking after that patient, or at least say to the team what you've done or not been able to do. And I found the shift planner. I still used it up until my last nursing shift because otherwise I was just staring at all these med charts and all these obs charts and getting a bit lost. So definitely helpful, yeah.
Thank you. And that brings me to my next question or tip. Always ask for help. And we kind of touched on this a little bit earlier, but really to, not even just your preceptor, but to everybody around you, asking for help is never a bad thing, right? Because every single one of us needs help. So remembering that you're not going to be looked down upon for that. It's actually a good thing. And especially if you get that like gut feeling that something's just not right, even if you can't pinpoint it, what it is, but something's just making you feel kind of uncomfortable about a situation, ask around, even if you have to ask a couple nurses just to kind of get a consensus. We work as a team in nursing, which is really great. So ask a couple of different people that you're working with, like, what do you think about this situation? Something just doesn't seem right to me. So, Clarissa, I wanted to ask you, have you ever had to ask for help before, and how did it make you feel when you asked for help?
Yes, absolutely. So especially if I feel unconfident about doing something, so I would usually find a senior colleague and then, for example, putting an IV line and then the patient's vein is very small. So I usually ask them, so what do you think? And if I was still unconfident, so they would do it. And I think it's better for the patient. Obviously, one successful attempt is always better than more than one. So, yeah.
Awesome. So tip number 9 is invest in a good stethoscope. I did this as a student and it helped me a lot, especially since I ended up on a cardiac and thoracic ward. So a stethoscope can last for a lifetime. I know they're not a cheap expense, and sometimes as a student it can be overwhelming to think that one little item can cost a lot of money, but they are worth it, and they can be one of your best friends when you're doing your assessments for your patients. And when you get more confident with that, I think it really does help you, and it helps you get an overall picture of what's going on. Lauren, I know you're in a different background with mental health. How many stethoscopes have you had? Because I have broken a couple on the way as well, I should say
Good
that.
question.
So I've definitely used them both in mental health, but also public health nursing. them a lot as we assess members of our community. But it's incredibly important, just like Beck said. It's your number one tool for assessment, right? That you're going to be utilizing, and so it's like your best friend. So you better get a really good one, right? So, like she mentioned, they can be expensive, but I even recently had students that, opted on the side of purchasing one that was like a little less expensive, and they had difficulty, auscultating and things like that. So they even saw the difference. So yes, absolutely, stethoscope's best friend.
Yes, so we reached tip number 10. Don't rely on your memory. People forget. So write things down. There's an old saying that we forget 80% of what we hear. So take down notes. When talking with a provider over the phone, write everything you hear. When getting a report from a nurse or provider, write it down as you hear it. If it's not documented, it is not done. So document, document, document. There was one occasion in the past where my documentation saved me. So I had a patient admitted to the ICU from the dialysis unit because of the patient's worsening conditions. So during the handover, I asked the dialysis nurse. So probably this might be different in different hospitals, obviously, but it was my Indonesian ICU. So the ICU was led by an intensivist, but the patient wasn't automatically referred to the intensivist. So during the handover, I asked the dialysis nurse if this patient was consulted to the intensivist, and then she said no, that she had already confirmed with the internal medicine doctor. So I documented this on my notes. So the next day, the patients got even worse. The intensivist came to me and asked why you didn't refer this patient to me. And I said, I already asked yesterday and I had my note, so I could stood my ground. So again, document, document, document. So I want to ask Beck, have you had any similar experience about documentation?
Yeah, definitely. It brings back a lot of memories about phone calls or paging doctors or other healthcare professionals because I never really received pages. They would call us back. And documenting that was a really good tip that I learned as a student because one nurse reflected on their not so bad experience, but unfortunate experience where miscommunication happened and something resulted. And so it was one of the things that they had passed on to me. And I found it also really helpful in our ward sense because we go pick up patients from the operating theatre. They don't necessarily write down the medications they've given on the same medication chart, which seems a bit silly now, and we've probably changed because we've gone to electronic record. But at the time, you'd think how easy it would be to double or triple dose on something that they've had. So absolutely, your memory might be amazing, but still legally write it down. It will help you and your colleagues and the patient.
Yes, thank you for summarizing the importance of documentation.
Sorry.
Yeah, so let's proceed to the next step.
So tip number 11, maintain your integrity. So integrity is one of the most important things that we have in nursing. We're considered one of the most trusted professions, and part of that is because of our integrity. And when I think about this, I think about, nurses cutting corners. We're very busy. It gets very chaotic and people kind of finding shortcuts to do things. Or when people make mistakes, that fear factor kind of comes in and they might feel compelled to cover something up so that they don't get in trouble. But just kind of remembering that integrity is there and it's the cornerstone of everything we do. So I wanted to ask Clarissa, have you ever had to report anything before? Or, what does integrity mean to you in your professional practice?
So if I can give a very good example of my nursing student. So she witnessed a bad practice during her placement. So she contacted me because I was the liaison lecturer, and I discussed this with the team, and we supported the student, talked to the student, and she decided to whistleblow. So it's a very brave thing to do, especially as a nursing student, and it's the right thing to do. So I think if you witness something bad and if you're unsure, talk to your team that you can trust, that can support you. Talk to them, raise the concern, and how to kind of whistleblow as well. So don't, as Lauren already mentioned, you don't work alone. Find your team members that you can trust and support you.
Thank you.
Awesome. So tip number 12, sorry, Lauren, set goals. I always struggled with this one because I used to think, oh, what do I want to do in 5 years? And then I had no idea and I'd get really overwhelmed. But setting career goals can help you maximize your professional growth as a nurse. And you want to make room for that, even though at the time as a new nurse, you might be overwhelmed and just thinking, okay, I need to get from shift to shift. That's okay. But try and think ahead a little. I used to do it as more of a 6 or 12 monthly thing. So was there a skill that I wanted to learn? Was there a particular nurse that did a really cool thing on the ward that I wanted to follow for a shift or even for half an hour to see how they did things? The 5-year thing came a bit for me. I don't know if that would have been the same for you, Lauren.
I'm the same here. I'm a really goal-oriented person, so I kind of like drive myself with goals, but I definitely set the short-term goals and the long-term goals. Because for me, like I said, like waiting 5 years to accomplish something, like I have to chunk it out in smaller steps. So I feel like I've gotten farther than maybe I have, or it keeps me on track. So I do the same thing where I'll set like smaller 6-month goals that I can achieve. And so like I remember when I first got out of college thinking like, oh, that's it. I'm done. I'm a nurse. I don't ever have to do anything again, and I'm never going back to school. And then once I was in and I kind of got through that first really tough year of, learning everything I never knew I needed to learn. And then after that, I was kind of like the fog cleared a little bit, and I was like, okay, now I feel like I want to set some more goals. So that really helped me. And actually, just the other day, I was cleaning out my drawers and I found a goal list that I had set for myself probably about 5 years ago. And I was like,
Amazing.
oh, I actually did them all. And I was like really proud of myself. So now I got to make a new one. But yeah, it's really important because it helps keep you going.
Do you set goals too, Clarissa?
It's similar like you, Bex. My goal is ever changing. I think when I first started, I didn't have kind of thing to achieve. Let's say it's just like I want to be a confident nurse. That's it. But after a while, I started like, okay, I wanted to do a master's degree, and then after master's degree, I want to do a PhD. And yeah, now I'm finishing. But I'll follow your path to set goals and kind of to have a benchmark to see how I progress in my career.
Awesome.
Yes. So for tip number 13, double check everything. We have touched on this a bit. Again, when giving medications, double check everything. 5 rights, we always say right medication, right patient, right time, right dose, right route. But sometimes nurse cut corners, as you said, Lauren. Don't do that. It's always safe to double check. This is also relates what Beck has mentioned. In back then in Indonesia, everything was still paper based. So if I couldn't read the doctor's handwriting for the prescription, I wouldn't give any medication. So usually what I did, I tried to find my senior colleague, which usually was better at reading, deciphering the handwriting. But if I couldn't read it, I wouldn't give it because I wasn't sure what medication it was. How about you, Beck? Do you still do that? And would you like to
Yeah,
share your experience?
thanks. Sorry. Yeah, so there are some medications that throughout public healthcare systems in Australia that you still have to double check some things. And I know that there are clinical areas like pediatrics and neonatal where you have to double check now. I did a little course that let me single check some adult meds, but I would still double check a lot of things, especially on things like when you're tired on night shift and you just need someone else's eyes to triple check what you're doing in the middle of the night. Absolutely double check. And like you said, with the handwriting or the dosage, if you think it might be a bit not normal, double check, even if you have like a medication handbook or something as well, and then run it past the nurse in charge. Because they might have seen that before, and if they haven't, then you can both realise what's going on. I think that's really important.
So thank you. Back over to you, Lauren.
So tip number 14 is take breaks when you can. So in the nursing world, things can get really chaotic on your shift. You kind of can't really predict when things are going to pop up that you need to take care of. So it's really important to take the little breaks when you can. Even if you can't take a whole lunch break and it's just a little bit here or there, I will say that I am terrible at this. Even still in academia, I find myself not taking breaks at all during the day because I'm so used to that kind of nursing mode on the floor. But trying to set time aside for yourself. So one thing that I've practiced is even, a little bit, even if it's like 30 seconds, just mindfully realizing that I'm taking a break or I'm kind of like processing what happened and kind of stepping aside for a minute. Those little things add up over time, and it can be really helpful. So I wanted to ask, Beck, what did you need any breaks during your first 4 years?
Yeah, definitely. And I was a bad student. Sometimes I wouldn't take a break because I felt like, oh, there's so much to absorb and there's so much to learn. Until one nurse said to me, it's actually your right and your duty to take a break, because if you're not rested, how are you going to look after your patients? And that kind of was like, okay, it's not about me being trying to absorb everything. And that kind of helped. We really need to take care of ourselves. I think now more than ever, through the last year and a bit, year and a half, what healthcare all over the world has been through, it's really been brought to light how important we need to take care of each other and ourselves. So please take your breaks, have a drink of water or whatever you want to drink that gets you through the shift, and eat and go to the bathroom and all those things. And if you think you're too busy, then ask for help. Go back to the other tip of asking for help to take a break. I don't know about you, Clarissa. Did you take breaks?
I honestly, it's the same like you all. I was bad at it, but again, work is never ending. There's always something to do. So if you're over the break, take it, believe me. And you can ask your colleague to cover for your patient, and you would do the same to your colleague as well. So don't feel guilty. So I'll continue with tip number 15. So it's prepare before calling. Before calling a provider, always make a list of things that you need to mention. Know all your lab values, radiology results, or everything you need. And you can't fully trust your memory. Remember our previous tip, especially when talking through a phone call, because usually the doctor is so busy and they always want to hang up. So in the hospital where I used to work, we use SBAR technique. So situation background assessment recommendation. I found that really useful. I always know what kind of information that I need to have before making the phone call. And when I was a very young nurse, not in terms of age, but experience-wise, I asked before I made my first phone call to a doctor, I asked my senior to kind of practice with me to have the role play. And I asked her to sit next to me when I made the real phone call. And so to have her next to me, it just made me feel more comfortable and confident. So probably you might want to ask that with your senior or your preceptor. How about you, Beck? Do you have anything to share related to preparation before calling?
We use the ISBAR technique as well. That acronym is really helpful. Sometimes if it was a really complex kind of situation, I would actually dot point it down in front of me as well, just so that if there was something really like I needed a few things addressed, I wouldn't forget. But yeah, definitely if you don't have that acronym, or you can use another one to help you like just get into a good habit of doing it, absolutely being prepared is really important.
I love how the tips are connected to each other. Yeah, so let's continue to tip number 16. Be flexible, be positive. So if you're asked to float in another unit for extra help, accept it, because you will learn a lot from floating to other units. If you're asked to do something new, take it as a learning opportunity, not as an additional work. My favorite place to be floated was the NICU. I was always excited to help there because all the tasks were so different, um, such as preparing formula, changing diapers, and plus babies are cute, so that's a bonus as well. Um, I want to ask Lauren if she has also been floated to another unit. What's your experience?
Sure. So I remember actually it was probably my first year. 'Cause usually where I worked, they didn't float you within like the first 6 months because they wanted you to get familiar with the unit. And I remember after that, always kind of being nervous that I was going to come in and be floated somewhere that I didn't know and what was going to happen and what was that unit like. Because you get familiar with the staff that you work with and you get comfortable, and then all of a sudden you got to go somewhere else. And so I remember being nervous at first, but then the more that I did it, it actually opened up a lot of different opportunities for me. I got to meet a lot of new people. Um, I got to work in all the units of this hospital, including in the emergency room. And so I gained a lot of different skills in each of the different areas that I wouldn't have gotten had I only stayed in that one area. And I think if I had stayed in the one area too long, I would have gotten really comfortable with that and not wanted to go anywhere else, right? So it really helped me kind of expand my skill set and make me, open to other adventures. And later on in my career, I actually became a hospital educator, and that previous experience of have floating everywhere, I knew a lot of people already. It made my job a lot easier. I kind of knew how all the units work, so I had something to bring and add rather than just being from one specific area. Um, so that really helped. And then, as time went on, even in my academic career, that really helped me having that like broad kind of perspective of all the different things and allowed me to kind of realize that even that little bit of fear I felt at the beginning, kind of overcoming that, like what a great thing came out of it.
Thank you, Lauren. I loved how you add a flavor of networking from your floating experience. So over to you, Beck.
Thank you. So tip number 17 is use proper body mechanics all the time. You might say that you're too young or too junior to ask or to know that, your back and your knees and your shoulders and all your body parts won't last forever, unfortunately, and getting injured is really, really not a good thing, to put it very obviously, but it's also preventable. It's really important to take care of yourself physically as well as mentally, as we've discussed. But I know that at my healthcare organisation, it's actually part of our policies and procedures that we have to use special manual handling techniques or not use them. Ask for help using aids, getting machinery in. If your workplace doesn't have that, maybe look at why, or if there's something that you could do differently, because you can't hurt yourself. Your patient wouldn't want that either. Lauren, it's not a nice question, but have you ever been injured on your job?
So, luckily, I haven't been. I think mostly because I try to follow the proper body mechanics when I can. It can be challenging, kind of like taking a break, And as I get older, I realize I wish maybe I paid a little bit more attention to some of the things, like how to bend over correctly, squat, rather than just bend things like that, because it does take a toll on your body, especially if it's something that you're doing day in and day out. So, kind of one of those little things that if you start practicing when you first become a nurse, it gets a little bit better. It just becomes second nature as you go on, and you'll be in better shape at the end.
Awesome, thank you. So next tip number 18 is plan for the worst and hope for the best. I think we've mentioned a couple of times, but you can't always predict how peaceful or how chaotic or how busy your shift will get. Always be prepared as much as you can. And I think that kind of follows into all these other tips of, it's not necessarily about saving time, but it's really about being prepared and understanding what your role is and how the team can help support you with planning as well. Clarissa, how do you plan your day, or how did you plan your day in ICU? I can't hear you, sorry. Are you on mute or is it just me? Sorry.
Thank you for pointing that out. Yeah, so I never really planned my day. So every time I went to the unit, I always thought that it would be a busy day. So if it's a quiet day, it was a bonus. So yeah, it's my lucky day if it's quiet.
Lauren, did you plan your day?
So, I mean, as best as I can, I would go in and with the information that I had, I would try to plan it out. But like I mentioned earlier, I always try to do everything as early as possible, because if I try to spread it out as if I actually had 12 hours to do all these things, it just never works out that way. So I try to do everything really early. And the other thing is a tip, just never walk on a unit and say, oh, it's so quiet today, because I guarantee you in about 30 seconds, all chaos will break loose. So whenever you think that, you better get stuff done right away, because it's coming.
And a lot of people will give you very angry looks. All right, next tip, Lauren.
So, tip number 19 is disinfect your stethoscope after each use. So, we have to remember that our patients are sick and they already might have a weak immune system. So, we don't want to be spreading those things around. And that's one of the things when I was working in public health and home care, I actually have bins in my trunk for dirty items, clean items, and we make sure, just like when you're going from patient room to patient room, that we're cleaning those things in between. We don't want to bring something from one house into another. So, it's a really good habit to get into of, when you're washing your hands, you clean your stethoscope too, right? So that you're not carrying that on. So I wanted to ask Clarissa, so the stethoscopes have been one of the primary routes of transmission of bacteria from patient to patient. So what tricks or tips do you use to remember to clean your stethoscope?
So I usually carried a couple of alcohol swabs in my pocket, so I didn't have any excuse that I didn't have alcohol swabs nearby. Again, build a habit that we have already discussed earlier. Every time after you use the stethoscope, clean it afterwards. So, and don't forget to replenish your alcohol swabs if you don't have them.
Thanks, Clarissa. And I guess we can probably add this to our list of good habits that we were coming up with too. So tip number 20, if you're not sure, ask. So we've kind of talked about this, but you're going to do this for the rest of your career. Always ask. If you're not sure, ask. If you don't know about something, ask. Whatever it is, make sure that you're utilizing the nurses and the staff around you so that you don't end up making a mistake or assuming that you know something. So I talked about that gut feeling earlier. If you just have this instinct that something isn't quite right, you just gotta ask your colleague. So Beck, how many times did you ask for help, you think, in your first year? And did it make you feel like a failure, or did you feel good about asking questions? How did that go for you?
I cannot remember because I think all I did was ask, but it was really welcomed. I never felt like a failure by asking. I thought this is the right thing to do. Like, as we said before, like not for you, but also for the patient, and also just in terms of your responsibility. Like, if you don't know, that's your duty almost and your integrity again to find out. All I did was ask, but it was very welcomed. I was very lucky. I had very supportive team members, and there's the one person that didn't want to be asked questions and you get that vibe of them, go to someone else and just say, I'm sorry to disturb you. I've just got a quick question. And if they say I'm too busy, come back, then they're too busy. I think everyone means well and everyone wants to work together. But definitely always ask to help.
Okay, thank you. So at this point, I think we were going to move on to our questions. So we have a couple of questions here. The first one is actually for me, it looks like. So it says, question for Lauren, I am interested in pursuing nursing and emergency management. Any tips for a new grad nurse? Should I look at getting an additional BSN in emergency management? So I would say first tip is to probably join your medical reserve corps in your community. You're going to learn a lot about the basics of that. From them, and there's different certifications and courses that you can do within that are really helpful, and you kind of, again, the networking and meeting a lot of people in the community that are kind of in those fields, and that's kind of how I jumped into it and got really interested in it. And from there's also disaster certifications that you can do after that. So I would kind of get into that first, see how that runs, and then see if maybe you wanted to do something separate in emergency management. Thank you for that question. And then I'm trying to see the other questions. One second.
Do you need help? I can read them to you.
Sure. Oh, so the next question, I have another one. So I'll give this one to Clarissa. So how do you know when it's a good stethoscope?
Sorry, just trying to find the unmute button. So if it's a good stethoscope if you can hear everything so clearly. So my tips, use the bad one first. So after you use the bad one and then try to use the nice one. I couldn't mention the brand, right? But I think everyone knows what's the best one. But it's so different because it could really hear very, very fine, defined voice, even. But I couldn't really describe it. But if you use the bad one first, and you would notice that how much different if the good stethoscope is. Not useful, but I hope it helps.
Thanks, Clarissa.
No worries.
And then, were there any other questions? Those are the only two that I can see.
Yes. So, speaking about preceptors, due to the massive turnover of nurses during the pandemic, how do you support your preceptors who are just starting in this role? Anyone in particular want to take that?
I just wanted to clarify. I think they mean preceptors like the person that's already working on the ward, taking the student or the junior nurse as their buddy. And I think really, as we can support them as colleagues or you can support them as a student, is just to be kind and understanding and ask them what they, you could set some mini goals for each other. What do you want to get out of that relationship together? But also just appreciate that sometimes on our organisation you get put into that role without knowing beforehand. So if they look at you like a bit surprised, don't be upset. It's not you. But yeah, I think just at the moment we all need to take care of each other a bit more, and being floated to different areas like we talked about can be scary, and you don't know what that kind of nurse is going through as well. So just ask. Yeah. Hopefully that answered the question.
Very good. So the next question we have is I am beginning my first nursing job this summer on a medical surgical floor, but am hoping someday to move to labor and delivery. How would I go about this respectfully? How long should I wait before looking at transferring units? Beck, you want to take a stab at that?
I was just thinking about the how long to wait part of the question. I think it really depends on how you are going on the medical surgical unit and how confident you're feeling in your skills and consolidating. And it takes a different time for each of us, I think, to really feel comfortable. If you know that going to labour and delivery or birth suite is really your passion, I would say go for it. But maybe I understand and I think it's really good that you're thinking about how to do it respectfully. If there's some clinical educators or some like associate managers or people that you can speak to about it, just in terms of learning what you can on your unit and those core skills and consolidating as a junior nurse is really important. But you can say to them, I'm really interested in this. Is there a nurse or a midwife in that area that would be happy to show me around? Or would I be able to do like a couple of supernumerary shifts there? I don't know if that would work in your own time or if they would let you do that as excuse me, as part of your job. But I think yeah, it's a bit of a delicate situation. So I appreciate the part about asking respectfully. In terms of the waiting, I don't know. I'm sorry. I guess, yeah, you just want to learn as much as you can and think about those core skills of primary assessments and secondary assessments. They're translatable everywhere. So it's really good to consolidate those two.
Very good. So we have a few more really great questions here. What ways do each of you practice self-care to prevent burnout? So maybe we could do a round robin. Each one of you give a quick tip about self-care.
Sure, I can go first. So that's one of the things that we really focus on a lot, especially in psych mental health, is I think it was Beck that mentioned it earlier, like we have to be able to care for our patients, so we have to be feeling well as well, right? So one of the things that I do is like kind of trying to steal a few moments for myself, either on my way to work or even on the way home, kind of practicing that self-reflection, either what happened before, the day before, and kind of processing that information, or what happened throughout the day and processing it on my way home, kind of clear my head and kind of get that out so that, like, when I get home I can have the other part of my life, right? And so it doesn't kind of follow me over there. And so just kind of using that part of self-care, and if you can, trying to exercise, get little things in here or there. But I do find it really challenging to find time to do it, so I've kind of tried to steal away little bits of time instead of having like a big chunk of time, and that's worked for me pretty well.
Probably I can answer. So you all can hear me, right?
Yes.
So it depends on the source of your burnout. For example, as an ICU, I was an ICU nurse, so I think the hardest part was seeing a lot of deaths and taking care of the sickest patients in the hospital. So what I would do, usually we discussed with our team, or probably someone within the team that you really trusted, and share your feelings, and debrief kind of if there's something bad and upsetting you when witnessing or taking care of the patients. So talk to your colleague, and talk to your friend probably. Sometimes it's just to have someone that listen to us, although they might not understand, but we need someone that kind of just be there and listen to what we said.
Yeah, I agree. I try and exercise. I walk outside if I can. I mean, it's getting cold and dark and rainy here, so it's a bit harder. But things like yoga and Pilates, if I can, even if it's literally 5 minutes, do it on the chair at work in your tea break, or do it in the car on the way home. Stop and pull over. But take those 5 minutes. I listen to music. I have a couple of songs that, if I had a particularly hard shift, I just needed to kind of zone out for a minute. But yeah, the debriefing was really important as well. Even if it was with people or other nurses not in your clinical area, that was good as well, because they understood the clinical aspect of why you might be feeling a bit stressed or burnt out. But ask for help as well, I would say, if you need to. I just want to plug that because that's really passionate to me. But most places have employee assist programs, and I know Sigma's got some really great resources as well. But yeah, it's hard to find time, but you need to make the time sometimes. Yeah.
Thank you for your honest answers. We have two questions in regards to how does a new grad get into either cardiothoracic ICU or cardiovascular ICU specialty, and how easy is it to start there as a nurse?
I can share my experience, but probably different systems depending on your hospital. So what I had, my experience, I started at the general surgical ward first, and then my charge nurse approached me one day, I think after I worked for a year or so, and then she offered, like, would you like to be transferred to the ICU? And I was like, okay, I'll think about it. And at that time, I never had been floated there, but basically my encounters with ICU nurses just kind of probably having a phone call, So what I did, this is my tip as well for you, talk to your senior colleagues that understood the nature of working in the ICU. If you know someone, an ICU nurse or cardiothoracic, talk to them, because what I found really useful, I talked to my senior colleague, and then she said, you know what? Because at that time I was thinking to move to work in a clinic because the salary was higher. But she said, think carefully. In ICU, you can learn a lot of things, a lot of skills. Just say, if you don't like it there, just work a couple of months, like 6 months or a year. And after that, you can move to other specialty, because that's the source of your skill in the hospital. And I was like, okay, I never really thought about it, probably because I was inexperienced. Um, yeah, so that's my experience. Talk to someone from ICU and discuss, and with your managers as well.
Very good. How does a nurse navigate any cultural differences that patients might have which may interfere with you rendering your nursing care? Lauren, it looks like your wheels are turning. Do you want to answer that?
I think that one, it's a tough one because it does happen quite frequently, right? I think the biggest thing is really learning about the cultures of the people in the area that you work, right? So if you have high populations of certain cultures, really being familiar with those and really being embedded in those communities so that you understand what they're going through and from their perspective. It helps rather than just kind of expecting people to shift to our way of thinking or things like that. So cultural competence, but on a much deeper level than just understanding like, oh, some, cultures might not make direct eye contact, like really getting embedded in it. And I have the luxury of doing that in public health because that's what we do. We embed ourselves in people's cultures and communities in order to help provide care for them. But I imagine, I don't know if either Becca or Clarissa have anything to add on this for their experience in the inpatient world, because it can be a little bit harder when they're just kind of coming into you and you're not working with them over long periods of time.
Yeah, that was a really good tip to kind of find out a little bit if you can. I found it was very diverse in our catchment area around Melbourne. Australia is really diverse, so it was a bit hard to learn, a bit about everything. But I would also ask and just be really honest and just say, what can we be doing, as a ward, and make it a little less about myself, even though maybe something was uncomfortable or something had happened. Just say, what can we be doing to support you? Is there liaison specialties that we can get in for you? We have different cultural, like pastor equivalents and things like that help. Or even asking the question, and if they're saying, oh, there's nothing you can do, we just, don't want to be in a hospital, then you can talk about that. I don't know if Clarissa's got any other tips, but yeah, I would just say ask questions and just be open and honest.
I have nothing to add because I was about to say ask them rather than we're guessing, because we don't know what their culture is like. And if we ask someone else, like our colleagues that don't know, it doesn't help. So ask your patient or their families, and I'm sure they will be happy to explain.
Very good. Thank you so much. We are nearing the end of our time. I want to thank so much to our presenters today for all of this great information. Sigma is grateful that you took the time to share with this audience, and we look forward to hearing more from you in the future. As a reminder to our attendees, please submit the state or country you are from in the questions feature. We hope you enjoyed this webinar. Be sure to check out Sigma's upcoming webinars, podcasts, resources to support you and your colleagues at www.sigmanursing.org. Also, previously recorded webinars and podcasts are freely available on the Sigma repository. Thank you for joining us today and have a wonderful day.